Can someone out there please explain to me why there are people in this world who apply for jobs and accept jobs that they clearly do not want to do or do correctly? Hello again, fans, followers, friends, and freak show. It's your girl Egodram with another video of me drawing and painting things. But this video is not going to be about drawing and painting things. This is going to be a for real conversation about something very serious. Serious enough that lives, or at least quality of lives, could depend on it, and that is the realm of emergency medicine personnel not taking epilepsy or seizures in general anywhere near as seriously as they really need to. Whether that's a general lack of understanding of common side effects from medications taken for epilepsy, and up to and including mocking people while they are having seizures or straight up accusing us of faking. Now, I shouldn't really have to say this next part, but I'm going to anyway so that no one misinterprets this video or its purpose, but I am the patient, not the doctor. That having been said, it should not be my job to educate an EMT or an ER nurse on my condition. They should already know what to do. Knowing the difference between a focal seizure and a TC is part of your job. If you do not understand the difference between loss of consciousness and impaired awareness, turn in your badge, cut up your lanyard, and go apply at Walmart, because you're more qualified for that job than you are at medicine. Now, in a general sense, an ordinary layperson not having an understanding of what epilepsy can actually look like, it doesn't always look like falling over, foaming at the mouth, or seizing. There's many different types of seizures, and they all look different depending on where they start in the brain, whether they affect the entire brain, the reason why the person is having them, such as a high fever or even a head injury. I understand that. I understand that a lot of common people out there don't have this kind of knowledge or understanding, and I will do my best within my ability to help raise awareness about that. But you there, in the scrubs, yeah, I'm talking to you, Deborah, you should know. Part of what inspired me to make this video is that a few weeks ago, maybe roughly a month ago, someone shared a post in a medicine-related subreddit, I won't say which one, involving an emergency worker scolding an epilepsy patient for deciding to cease taking a certain medication called Keppra. Now, those of us with epilepsy, those of us who have never taken this medication, are familiar with one particularly notoriously unpleasant and sometimes dangerous side effect associated with this medication. So bad that I honestly do not know how this shit is still legally available in the United States. This side effect of Keppra is colloquially known as Kep rage. And yeah, pretty much exactly what it sounds like. Really severe mood swings to the point of anger. Like the good old vein in the eyeball bursting anger. I have also heard anecdotal stories of episodes of violence, but I haven't seen any documentation proving as such. But, the medication doesn't excuse that kind of behavior in instances such as that, but it would explain it if it was true. But yeah, Keppra has been known to cause very extreme mood swings, commonly known as Kep rage, and I do not blame this patient for not wanting to take it anymore. And when the patient tries, at least according to the story, to explain all of this to the emergency personnel, they didn't want to hear it. Instead of understanding or some form of reasonable advice, this patient was met with dismissive comments of, well, it doesn't matter if you don't want to have seizures, take the stuff anyway, or it can't be that bad, or they wouldn't have prescribed it to you, yada, 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 yada. And a whole lot of ableist yada, yada later, the patient was just sent home without any new medication or procedures or recommendations or advice or anything. Now, that particular post was since taken down because a whole bunch of people who have epilepsy, including myself, went to that post, commented on the post, calling that emergency worker out for being an ableist POS, and the subreddit shut the entire thread down. But not after having the audacity to get mad at people with this condition for saying, hey, it's not that simple. This is a snapshot of what our lives are really like. what it's like having to live with this condition, what it is like having to live with other people not understanding this condition, and what it's like trying to function in a society that wants to punish us for living with the fourth most common neurological disorder on Earth. According to OP's account of things, OP, claiming to be the emergency medical personnel themselves, they sent someone home, unmedicated, unsupervised, after knowing full well that they had just had a seizure and not a small one. I sincerely hope that someone who saw that Reddit post tracked down where they worked, showed their boss the post, and that they no longer work there. How the hell does somebody who works in emergency medicine not understand how truly dangerous a seizure, any seizure, even a focal seizure, can be? What exact brand and flavor of cereal box did this person pull their license out of? Now keep in mind as I continue talking, this is just one story about a person with epilepsy being neglected by medical staff when they have the audacity to inconvenience them by seeking help after they've had a seizure, such as a young person being brought to the emergency room after having 4 focal seizures in a scope of less than 2 hours, being called a liar by medical personnel at the hospital, and they only respond when the poor kid, quote-unquote, has a real one. Or being told by a medical professional that it, quote-unquote, wasn't a true seizure because you didn't bite your tongue or lose consciousness. Or even when the staff is barking at you because you're, quote-unquote, being rude or uncooperative while you're clearly experiencing postictal symptoms, the very well-documented effects of which have been known to include confusion, mood swings, and in some rare cases, full-out psychosis. In general, I am just dumbfounded at the sheer magnitude and toxicity of ableism from people who should absolutely, 1000%, without a shadow of a doubt, know better. I also hate, like how I saw in the comments of that particular Reddit post and others about the general subject of epilepsy, that the comments are just blanket assumptions that anyone coming in complaining of having had a seizure or having some in rapid succession, that, oh, they must be faking it. I remember the story of a girl who was obviously faking it, not real, faking it for attention, doing it for TikTok, this, that, and the other. Like, yeah, okay, look, I also have a TikTok. I am familiar with the phenomena of people faking shit for attention. I know it's a thing that happens, but again, why in the absolute unholiest of fucks would you voluntarily join a career field that would require you to administer medical care to people who more than likely are not faking it? What does it possibly benefit me to fake my seizures? What could possibly be the advantage of being diagnosed with a neurological disorder that emerged as a result of a traumatic brain injury that affects my legal status as a United States citizen, affording or limiting certain legal rights and privileges in this country? Why would I fake that? Why on earth would somebody pretend to have a neurological disorder that in some states bars them from entire career fields and automatically gets their driver's license suspended or even revoked? What's the play there? I am at present unaware of any epilepsy medications that have intoxicating side effects to them. So, nope. I mean, the medication that I've already been on for years has been pretty effective. So, I mean, I don't really think I need any new ones. And if I wanted to get high, I could just go find something else. I don't need to get it from your ER. So again, what advantage, why would you think I would fake this? My risk of meeting with a premature end to my existence is up to 3 times higher than the general population of human beings. Why would I pretend to have this condition? You know what? Just forget all of those questions. that I just asked for just a moment. Set them aside for just a moment, because the more important question that I want to ask that's related to those previous questions isn't just concentrating on why do you think I would fake this with so many little known or little understood side effects. Why do you have such a strong, immediate inclination to assume that I would lie about it? Furthermore, how frequently do you accuse your other patients of, lying or faking it for attention? Unless you are a neurologist or know how to read an EEG, why do you think it's your place at all to just assume I'm lying and send me home? If I have a seizure and hit my head, then examining me and hearing me out is your job. Do your job. I am entrusting you with my safety and seeking your help. And if you don't want to do that, then hang up the badge and go home. Your unwillingness and or incompetence is a threat to my safety as well as the safety of the general public. If you can't or won't do your job or do it correctly, you should not have it. It is not my fault that your med school or nursing school instructors failed to teach you the basics of your profession, just like it is not my job to compensate for their failures. Do your job, do it right, or go home. I did not ask to be epileptic, so why the hell would I fake it? I did not ask for a permanent, incurable neurological disorder that is just as likely to shorten my lifespan and puts me at far greater risk of developing Alzheimer's later in life than the average human being. This condition that I have little to no control over, even with medication, and that I, since I do not experience auras, cannot predict, leaves me vulnerable physically at the expense of other human beings, especially predators and law enforcement. I did not ask for this. I might come into your facility asking for help if something goes seriously wrong. And that's all I want, is your help. Without judgment, without being called a liar, I am asking for help. Physical, neurological, medical help. And some understanding. I don't think that the absolute least, taking some time to look at the World Health Organization's information about epilepsy, the CDC's information about epilepsy, epilepsy foundations all over the world, and look at their research and learn what's up and how to actually help, what to do, what not to do. As someone who actually has to live with this condition and has had to make substantial life changes in order to safely manage this condition to reduce my risk of injury or further complications, I am relying on that understanding, that knowledge that you're supposed to have, your capability to do your job. I am relying on that. To some extent, I am putting my life and safety in your hands, and if you do not want that responsibility, or you cannot handle that responsibility, hang it up and go home. It really should not be difficult to explain that ableism is disgusting and has no place in a civilized society, but especially so in the field of medicine. Come on. Come on! Really? You, in the scrubs, you should know better. And if you don't, then that's your own damn fault. Do your job. Get better at your job. Do better. Be better. Or go home and stay there.